The biggest tips for dental extractions is to be patient. If you are trying to rush the extractions because you've got clients waiting, you've got emergencies coming, you've got 4 more surgeries to do, that's when you're going to have problems, and it's going to be worse, and it's going to take longer. It's important to recognize that dentistry is not about strength. It's not about speed. It's about patience. And you want to be speedy. I mean, you don't want the animal under anesthesia any longer than necessary, but to extract teeth correctly, you need to take the teeth and section them into single rooted segments. So each tooth should be just one root, and you want to basically use a high-speed handpiece on a water-cooled, air-driven high-speed handpiece, and you want to cut the tooth into sections so that there's only one root per section. Remove each of those individually, and that way, as you do that, you can soften and weaken the ligament that's holding the tooth in place. So I like to think of the periodontal ligament as a hammock, that the tooth is sitting in this little hammock between the tooth and the bone. And it's just bouncing in its little hammock. It has a little bit of cushion there, and you have to cut the webbing, the fibers of the hammock in order to get that tooth out. You can either cut them or you can stretch them to the point that they break on their own. But dogs' teeth are designed to withstand very rapid, sharp movements. So just like in the wild, for example, if a dog is trying to catch a prey that's running away from it, that's a very sharp movement, very rapid, very forceful movement that those dogs' teeth are designed to withstand. Because if they came out that way, then the teeth would be like in the antelope running away from them or whatever they were trying to catch. But if it was a slow, steady, gentle, even, long-lasting pressure, they can't withstand that. So that's what that hammock, that ligament is designed for: rapid force, really forceful, bounce back. And that it withstands very happily. And that's the biggest frustration that people have when they're trying to extract teeth, is they're fighting against that in the way that it's designed to handle. So you have to approach it in a very slow, very patient, very steady, very gentle pressure. Actually gets the extraction done more quickly than trying to rush and do it in when you know you've got lots of too many other things happening.